It is Thursday. That means we have a vet on hand to answer your pet questions. So if you have a problem with your pet, you can give us a call right now. The number is 460-KJRH. Dr. Joe Landers is here to answer your questions, and he's brought along Muggles this morning. Good morning.
Muggles. Don't let the name mislead you. This is a little girl dog. She's probably half Jack Russell and half Westie. She's kind of a tall, sort of drummed down Jack Russell. She's not quite as hyper, but she's a little terrier dog. Runs around. Really nice little dog. She's about 4 years old. She's over at Heritage right now, 627-8575. Good little dog. Someone kind of found her. She's got a haircut here, so usually her hair's quite a bit longer than this or whatever. But a good little terrier dog.
Seems like it.
Yeah, if you're looking for a little terrier, she's a good one.
Posing for the camera well as well.
She really is. She's doing well here. I just gave her a treat, and she's really. I'm always afraid sometimes these terriers get really hyper, and she's really calmed down well. So
seems like it. And people can also find her on animalaid.com, right?
Yeah, animalaid.org.
Yeah. All right. Let's go to the phones. First up today, we have Connie from Skiatook. Good morning, Connie.
Good morning.
Hi.
What's your question?
I have a brindle boxer, and my husband accidentally poked him in the eye with half of a cookie.
Yeah.
And so it's all kind of red.
Yes.
The other eye's red, and he's been sneezing.
Okay.
Our vet told us that we could give him Benadryl, and I wanted to check with you and see if that was all right.
Absolutely. Benadryl's given at about 1 milligram per pound. So if your boxer's around 50, it actually takes 2 Benadryls twice a day. They metabolize them much quicker than you and I, so their dose is a little bit more. If we see a lot of blinking or that doesn't clear up, then you bring him in, have your veterinarian just kind of check the eyes, make sure the cornea is not scratched or anything, and get some eye drops. So,
all right. Let's go to Helen now in Tulsa. Good morning, Helen.
Good morning.
Hi.
What's your question?
I'd like to know how you declaw a cat, and can you declaw a cat after it is older?
Yes, and declawing cats, I always tell people, full disclosure, we're cutting off the very end of their finger. But the way they work is our finger goes down and theirs kind of goes up and retracts back out. I usually have a little talk with people to make sure they're okay with it, that it needs to be done. Some cats don't ever scratch or do anything, so sometimes it doesn't need to be done. You can definitely do it when they're older, generally just the front feet. Sometimes there's these little pity paws you can put on, which are little caps. But to be honest with you,
like little socks for the cat?
Well, little tiny caps that go over the nails, and that kind of helps. And sometimes while they're learning, if they don't scratch too much, but usually those start falling off, and after a while, they can do that. We can also teach people how to cut their nails. So,
all right,
there's a lot of different
options.
Yeah, a lot of options there. You don't necessarily have to always declaw, and a lot of times people think it's cruel, but honestly, sometimes that's the only alternative. I had one cat that was beating everybody up. I declawed him, and all of a sudden, he was very nice. He realized, he didn't have the upper hand anymore. No pun intended. So, anyway.
Good deal. All right, let's head out to Chelsea now and talk to Linda. Good morning, Linda. What's your question?
Hi, I have a 4-year-old female pug, and she's been spayed. What do you? Is it neutered or spayed?
It's spayed for a girl.
Okay. Well, anyway, she's this past year she's been having. She gets excited and then she falls down on her side and starts. It looks like she's having kind of an epileptic seizure.
Sure sounds like it.
And when she is okay, her tongue is hanging to one side of her face. And
you might want to have your veterinarian check that. If she has a little facial nerve paralysis, or a lot of times we call that palsy, their tongue will stick, and sometimes their eye kind of droops and stuff. And sometimes there's not much we can do about it, but it may be that you want that kind of checked out, especially if we're having some seizures too, because then that's kind of 2 neurologic problems. So someone needs to probably look at that and kind of give you some direction. And if she's having progressiveness, there's some medications to put on for seizures too. So.
All right, good deal. Well, Dr. Landers is here every Thursday to answer your pet questions.